Okay, everybody, hello and welcome to Beyond the Badge. It is our season 3 debut, episode 1 of season 3. Our audience is starting to file in to join us for this kickoff of our 3rd year of Beyond the Badge episodes. And I want to thank all of you for continuing to come back month after month. I know we have a lot of new guests coming in here who are supporting honorees, and the first time they're seeing a Beyond the Badge episode here, which is our 25th overall. And many in our audience who continue to come back are our leadership from around the Mount Sinai Health System. And we expect to have a couple of hundred of people watching in as we continue this episode. So thank you for joining us. As you saw in the opening credits, and for those just joining, where does Beyond the Badge come from? What is its purpose? Well, every single day, the Mount Sinai Health System holds a system daily huddle. All of our executive leadership from all across our hospitals and ambulatory practices and various service lines come together to ensure we are set for an exceptional, high quality, safe day across our health system. And they report in and they take a pause during every single daily huddle, and they allow one leader, one of our senior leadership, to share a story that inspires them. Whether it's a patient letter, you'll see some of those. It could be a star appreciation, which is a peer-to-peer appreciation program, or it could be just this one-time remarkable story of excellence, or perhaps to spotlight a special program or work that's being done that they're so proud of. They get one chance, and the people you're going to meet today, the stories we're going to share, are those one person or that one team that they wanted to highlight last month. So these are the stories from January of 2024, collected and brought to you in this episode of Beyond the Badge. So I'm thrilled you could be here. We're going to start things off and go into our stories, but I love to lead with an introduction of some of our leaders who are out in the audience, who are the ones who continue to come back and watch these episodes. I know one leader who's excited to be here is Dr. Adi Sharma, who, because he knows there's a couple of big South Nassau teams. He's the president of Mount Sinai South Nassau. There's a couple of big teams early on. There's another individual celebrant later. And even though, Rob, you're double booked at another event and a speaking engagement, had to come and join us. So welcome. And I'd love to turn it to you to say hello to our audience.
Thank you, Steve. And really want to give you a shout out for you and your team on the great work you do on this recognition event. So also very proud of the South Nassau teams being recognized today. I'm here, as you mentioned, at the Go Red for Women's Health event. And I'm sitting next to 3 other leaders from South Nassau: Kathy Mann from cardiology, Peter Fromm, our AVP for cardiac services, and Jackie DeBarry, our nurse manager from D2 East. So good leadership representation here today. And we really want to congratulate all the honorees, but special congratulations to the Mount Sinai South Nassau teams being recognized, the ED, the CCU, the E1 teams, Cindy Borquez and Tess Caffrey, and the E2 team. And then a special shout out to Maureen Eka in the lab. The lab is often, the behind the scenes folks that make sure we get our work done in a timely fashion. All of these teams do really exemplify we find a way. And I'll highlight one story. We just had our Joint Commission survey last week, Steve. It was a phenomenal survey. And the surveyors recognized the ED for their work on Left Without Being Seen and maintaining a success rate below 2% for over a year. This is a daily effort that they do. Twice a day, they have a meeting and a huddle with senior leadership to get this done, because we find a way, Steve. We get it done. So congratulations to everyone being honored today. A special congratulations to the Mount Sinai South Nassau teams. And I'll give an opportunity for my co-leaders here to share their congratulations as well.
Oh, excellent.
I'd like to congratulate the whole team. It's all of you, each and every one of you, that contribute to the care that our patients, that is reflected in the care that the patients receive. And that's why that patient wrote the letter. It's every day. It's not just that one patient.
Congratulations to the whole team. It's such an achievement and really a huge recognition to be on Beyond the Badge.
And it is a true team. None of us can do anything by ourselves. It's an extraordinary team that tries to do the right thing every single day.
Wonderful. Oh, well, thank you. Tune in. I know you're at the other event. You can go off camera and just listen into these stories. We're going to start with those Mount Sinai South Nassau teams right off the bat. So thank you.
I'll have my AirPods on. Thank you, Steve.
All right. Thank you. Another leader I'd love to introduce who I know is here is Rodney Miller. Rodney's our Vice President for Security and Protective Services for the Mount Sinai Health System. And Rodney is one of our newer senior leaders here at Mount Sinai, just joining us in 2023. So thanks, Rodney. Great to meet you. And I'd love to give you a chance to welcome our audience today.
Thank you, Steve. First and foremost, I want to congratulate everyone that's being honored here. I also want to thank the family, friends, and colleagues that were able to kind of join and be part of this celebration. You know, I've only been here for 6 months, and I've traveled to every hospital within the health system and all the major ambulatory sites. And I've been very impressed with the leadership, professionalism, level of care, dedication, and sense of family this organization has. So I'm so excited to be here to be recognizing and celebrating one of our own security officers, Joshua Richard. Again, the security officers for Mount Sinai Health Systems, I believe, are the unsung heroes here who put themselves in harm's way each and every day to protect the patients, visitors, and employees here at Mount Sinai. And the way to do it with a sense of professionalism and compassion is amazing to me. And they come to work every day with the same sense of enthusiasm and willingness to do great things. So I just thank the team for inviting me here today to speak on behalf of the security apparatus here at Mount Sinai. And again, congratulations to everyone.
Thank you so much, Ronnie. And that is something 43,000 of us at Mount Sinai agree with, is how much we appreciate our security officers and our security team. So thank you so much. Looking forward to celebrating Joshua a little later on in the episode. But thank you for joining us and for watching today.
Thank you.
All right. Well, I want to jump into it now. My team backstage, I'm going to save my thank yous for a special moment later in the ceremony. There's so many people to thank to be a part of Beyond the Badge as we kick off season 3. So I'm going to hold those thanks for now, but they're going to drop in the program, a program you can follow along with. And you're going to be able to see a few stories in that digital program for those who could not make it today. It is a health system. They're with patients. They can't step away. They're very appreciative of the honor, but just could not attend today. So we have one you'll find for Janista Clark-Seaforth of the FPA Access Center, who was praised in a patient letter. Another for Jesse Coe, a CT technologist at Mount Sinai Queens, recognized for his commitment to patient safety. You'll see one for thoracic surgery project manager Natasha Correa of the Mount Sinai Hospital faculty practice. She was recognized by colleagues for her as an outstanding team member. And you can read one more story for VP of Operations Vadim Leko at Mount Sinai Brooklyn, highlighting his exceptional work and expertise. So those stories are in your program as written entries. So after this episode ends, you want more inspiration, go into our program and you can read those stories. But follow along. We've got another 15 excellent stories to share with you live, and they're going to be shared by our committee members. So we're going to go first. This is our Mount Sinai Spotlight Committee, those who are actively involved in leading recognition and appreciation efforts at all of the different sites and practices and areas around our health system. And I'm going to go to Robert Gonzalez first. He represents our committee at Mount Sinai South Nassau. And we're going to start with some big teams, Rob. So I'm going to turn it to you. We've got this is our first big team, which includes emergency medicine, the CCU, and the E1 teams, and a fantastic letter. Rob, I'm going to turn it to you to share this story.
All right. Thanks, Steve. So a patient who spent a few days with us after suffering cardiac arrest wrote a beautiful letter titled Avengers Assemble, in which he expressed appreciation for an amazing all-around experience. In the 2-page letter, the patient wrote, "I can't begin to say thank you enough to everyone. You probably feel as if you were just doing your job, what you are trained to do. To some, your compassion comes naturally, while others may feel like you have to work at it. No matter why or how you get there, your work is appreciated more than you can ever know. The way you, the people at Mount Sinai South Nassau, are able to do what you do is incredible. Not only do you have a skill set that is highly unique, but you also have shown the ability to do it with compassion, sympathy that make patients feel as good as possible given the situation. From the man at the front entrance who immediately took me back with no questions asked, to every member of your clinical teams, to the gentleman who took the trash out of my rooms, you are all heroes. This letter really highlights the multidisciplinary coordination and efforts that contributed to a great outcome, which exceeded expectations. Great job, teams."
Yeah, thank you, Rob. And I'm sure the leaders of these various teams have shared that full, detailed, and emotional 2-page letter. It really is incredible. And I'm just wondering, this is a small sampling of folks and leaders from these larger teams. It's a very large group of a few departments. But if someone could speak and represent these groups on what a patient letter like this means to your teams, and how does it help you connect everyone to what makes Mount Sinai South Nassau a really unique and a special place to work and receive care. Can someone speak on behalf of this group and address that?
Yeah, I'll speak. Hi, everyone. Dr. Smirda's Cardiology. This is a beautiful letter. It's literally food for the soul of the healthcare team. And, I want to thank Ian. He's a highly intelligent guy who really understands how complex his case was and how every single thing had to go right for him to have this beautiful outcome. And, we're talking about a healthy guy who was playing a long tennis game and then shortly after had a cardiac arrest, and from a very rare condition. When people get sick like that, they're really hanging at the edge of a cliff with one leg out and one arm out, and we form as a team a chain, literally a chain holding them on to life. And every single link of that chain has to work. Like from the phlebotomist, the person who basically, registered him. If you do a mistake on the registration, you don't get the right record. Like the person who drew the lab carefully without a hemolyzed specimen, to the ER attending, to the people who jumped in high quality CPR, to us taking him to the lab right away and finding we had a very rare heart attack. And, Ian saw and appreciated that. And it's great to see him being healthy and playing tennis again. It's important to take this time for us as a team to reflect on what happened, because like times of reflection on good outcomes and non-ideal outcomes is what really enforces good habits and good practices and to improve the ones that, need improvement. So I think it's great what you're doing. And I hope Ian gets the chance to listen to this and know how much we appreciate the letter you wrote.
Yeah, absolutely. And you're right. To reflect on that letter, I hope it's something you go back to at different times over the year and over the few years. It's such an incredible letter to keep reflecting on it.
No, I mean, I do, I'll tell you 10 seconds. I have like a collection of letters on my desk right at eye level across my office. And during the pandemic, when I slept on my office floor at night, taking care of the COVID patients, it was a very stressful time. I kept reading these letters and thank you cards. And I'm telling you, this really, like the impact of these letters is what keeps you going. It's at the hardest times.
Right.
So,
like you said, food for the soul. And so I hope it really fills and everyone on your amazing teams who are all mentioned in this letter, incredible teamwork across what everyone is doing. So thank you to you. Please extend that appreciation and this moment of recognition to everyone on your teams so they can feel that love as well. All right. Well, thank you all. We're going to go into our next story, but congrats again to you all. And thank you. We're staying in South Nassau. So Rob, stay with me. It was another team that was recognized. This time we're going up one floor from E1 to E2. We've got Cindy Borquez, Tess Caffrey, and the staff of E2 being recognized in this story. Go Rob.
All right.
Hey.
All right. So our ortho-neuro-surgical unit E2 recently celebrated a long-term patient's 21st birthday. The patient was very near and dear to E2's heart, having been a long-term resident on the floor last year and coming up on a 3-month stay. Knowing this was a milestone birthday, nurse manager Cindy Borquez worked together with the patient's parents, the E2 staff, and Tess Caffrey from Patient Experience to make her 21st birthday as special as possible. They decorated her room with garlands, posters, and balloons. Food and Nutrition brought her a milkshake, pudding, and cake with a birthday crown and a happy birthday tray. Each E2 staff member wrote a birthday card, and they got her a paint by number canvas to help pass the time. And finally, her parents brought in the birthday cake as the staff sang, and they popped bottles of sparkling cider to celebrate her on this milestone birthday. Watching the team come together to lift our patient's spirits was just a powerful experience. It was a joy to be able to celebrate this momentous occasion with the patient and her family. Great job, E2.
Yeah, a really wonderful story. So emotional, so inspiring. And I'd love to see who can represent this team and speak to the culture of this team and on this unit that leads to such remarkable moments and experiences like this that you create together. It was a real team effort. Who can speak to that?
So the culture on E2, hi, I'm Cindy. The culture on E2 is very much that of teamwork. We work with multiple disciplines on the unit to help ensure care is delivered, quality care to all our patients, but especially in the emotional sense, because we do tend to have patients that are here for longer periods of time due to either comorbidities or complications. And when they're here, we want to ensure that their stay here is not just a hospital stay, but also they are recognized in who they are as a person. And we have the ability to work and collaborate with multiple team members, tests, A&Ms, RNs, LPNs, and even our providers to ensure that our care is delivered in the best way possible for everyone.
Yeah, really well said. And I can feel that it's not just like this was this incredible experience and this incredible moment, but that culture lives in how you would treat every patient, whether it's this miraculous moment or just an everyday moment to treat them as people. And that's really wonderful to hear.
Thank you.
Thank you.
Wonderful story. Thank you all. Congrats. Thank you for what you do for our patients. Really, really wonderful and inspiring story. All right, and thank you, Rob. We'll come back to you later on for Maureen's story as an individual later, but we're going to go out to Mount Sinai Morningside next. We'll have my colleague Tyler Geegan come up. I saw that team join. Let's bring on the Mount Sinai Morningside Cardiac ICU and Step-Down team. That includes Sandri Mendoza, Ciara Rhodes, Dr. Matthew Tommy, and Dr. Hans Reyes. It also has Marianne Dizon, who is an overnight worker, and she let me know what a beautiful message she sent me this morning. She was so touched and appreciated, but putting her patients first, realizes as a night shift employee, she needed to get her rest to be at her best for her patients. So a special shout out to Marianne. We might not have the team on camera to share with them. So Tyler, let's start the story and we're going to try to bring them up. I know they're here and listening.
Okay, great. Thanks so much, Steve. Yes, we're really excited to recognize this team. So a patient wrote a letter of appreciation for the Mount Sinai Morningside Cardiac ICU and Step-Down units. The patient said, "Please accept my profound gratitude at the care provided by your staff during my hospitalization. Having turned 70 a week before, I considered myself in good health until I suffered a myocardial infarction and became critically ill. The cardiac team, spearheaded by Dr. Matthew Tommy, saved my life, and my gratitude is unending. My journey back to wellness was quite difficult. Never before have I felt so vulnerable, but the staff showed me nothing but kindness no matter how often I needed to be attended to. Nurse Mary Ann was unwavering in her attention to me and my family. She's an absolute gem. Nurses Sindri and Sierra were also very caring, and my current cardiologist, Dr. Hans Reyes, whom I met as an inpatient, has been wonderful in dealing with my concerns upon my discharge. The entire staff excelled in their provision of care, and we are so proud to celebrate this team for going above and beyond and making such an impact on this patient."
All right. Yes, thank you. So now we're looking for this team. I think they're under a different name under our Beyond the Badge. So if you're out there, team, we don't have you up on camera here, but let's turn it to you and see if you can speak to this experience. Tell me about this team and this unit and how you aligned and how you provide both excellent care and an excellent patient experience. And we'll find you and pop you into the spotlight as you're going. Is this our group? Is it Dr. Tommy?
Hi, I'm here just as one representative of the team. I would, if there are others on, I'll by all means let them speak first.
Sure. We were looking for them. They may have had some trouble coming on, but I know you were so proud of the group. And I saw you immediately returned it back to them and said, what an incredible team that you're working with. You were so proud of them being recognized by this patient. While we continue to look for them, I think they're listening in as an attendee and not on camera. So if you want to take a moment to share your appreciation for this group, I know they're listening.
Absolutely. I think that I'm very grateful to this patient for taking a moment to emphasize what I think we need to emphasize more every day. A person who previously considers themselves well has some abrupt change in their health that lays them low and brings them into a hospital, whether it's a heart attack or something else. And I think that there's maybe a lot of spotlight and sensationalism about, opening up the artery in the heart attack and things like that. What this patient helped us to really appreciate is the totality of what matters to a patient who's suffering an illness, and how wholly this can change their self-perception, their sense of being an intact human being. And if we simply focus on the mechanics of opening a blocked artery, we miss the lion's share of what's actually affecting a person's wellness, and certainly their experience of being a patient in our hospital. And so if we lose sight of the fact of all the parts of what we're doing to take care of that human being, then we are really failing to do our job. And I think what was so wonderful here is that this person who came with a heart attack discovered things about toileting and being heard and being made to feel comfortable that were so important to the experience of becoming whole again and becoming well again. And it takes a partnership, it takes a wonderful team. And I think it's a testament to how great our team is at Mount Sinai Morningside and the cardiac ICU, how much we love doing everything that we do to take care of the human beings that come to our unit every day, that we were able to take care of this patient as well as we did. So I feel very privileged to get the chance to work with our team. And I look forward to taking care of many more patients just the way we did for this patient.
Well, thank you so much. I know you were here more to cheer on them as a member of this team, but I know they're listening, and I know that means a lot to them. I love the quote, "Never have I felt so vulnerable, but the staff showed me nothing but kindness." And it really speaks to the group. So again, continue to extend your appreciation and our appreciation to the group. And as you're listening out there, we thank you all. So thank you for joining us today. Okay, and next up, we've got one more team before we move into our individuals. I know they're ready to go. It's our Mount Sinai Doctors Long Island Green Lawn team, who are recognized by our Mount Sinai Network Practices leadership, and includes their leader, Taryn Elizabeth Rosado, as well as Brianna Hardy, Norma Lopez, Danielle Clagg, and Felicia McShann. And I'm going to have Kathy Gilbert from our marketing team represent our network practices here today and share this story.
Hi, Steve, and thank you to the team. Dr. Sunil George expressed the following appreciation for this Mount Sinai Doctors Long Island team, saying, "I had an acute consult requested by a community physician for a patient in the medical field. I spoke with my team, including but not limited to Taryn Rosado, Brianna Hardy, Norma Lopez, Danielle Clagg, and Felicia McShann. Even before 9 a.m., they got this patient on my schedule, had a CT scan approved and completed, got labs ordered and done, physically transported the patient in a wheelchair between some of these areas, literally provided a shoulder to cry on when the patient was in pain, and made her comfortable with a blanket and water on the exam table. This experience makes me proud to be part of the Mount Sinai Doctors Long Island group."
All right. Yeah. Thank you so much, Kathy. And it makes me so excited to hear of one of our providers just seeing an experience of a team working so well and with such passion that they needed to write a letter and submit something and talk about how proud it is to work with this group. And I'd love to turn it to this team. I believe Taryn is going to respond on behalf of the group. But can you share, what makes this team so effective together? And how do you all commit to providing such exceptional and caring experiences for your patients?
I think we really personalize it, and we say, what if this was, your grandmother, your brother, your cousin, and we really think about how we would want to be treated in this situation, or how our family members would like to be treated. And I have to say that the team that we have here and our entire facility, we work together. We make it happen no matter what department. We really get it done for the patient. It's all about the patient experience for us.
We make it happen, an extension of we find a way. Well, we make it happen. I like that mantra for the team, and knowing that you've got such a great collaborative group that is all committed to the we make it happen mindset, that we're going to do this, we're going to do our best. And that was shared. I'm so glad the patient took the time, and the Dr. George took the time to name you all by name of what he saw and what the difference it made for our patients. So congrats to you all. Thank you so much for the great work you do at our Mount Sinai Doctors Long Island practices out of Green Lawn. And thanks for being here today.
Thank you.
Congrats. That wraps up our team awards here that we're doing. Although we have one more two-person team, we kept in one of our other categories. Our other categories are appreciation from patients, We have appreciation from colleagues section, a stories of excellence section, which is some one-time remarkable stories, and a spotlight at the end that was spotlighting individual employees for the great work that they're doing or a program they're running. We're going to start with appreciation by patients for our individuals, and we're going to go to Mount Sinai Queens first, where we have Helen Centeno being recognized, and I'll have my colleague Zach Key share this story. So let's bring up Zach and Helen.
Thank you so much, Steve. So, a Spanish-speaking patient reached out by phone to share his overwhelming positive experience with Helen Centeno in the Mount Sinai Queens Outpatient Imaging Department. He shared that Helen has been kind, professional, and always helps him during his hospital visit. Helen goes above and beyond to help him understand all the information that is being provided. He is always concerned that he may forget something, but Helen is able to explain the provider's instructions in a clear and digestible way. She is patient and thorough, even when the clinic is busy, and he wanted leadership to know how valuable Helen is to the hospital by the way she helps Spanish-speaking patients. Congratulations, Helen.
All right. Yeah, thank you, Zach. And Helen, this patient really focuses on how well you communicate important information and instructions. I mean, those are patient experience metrics that we really care a lot about. Can you share your approach to this aspect of communication and how you help patients leave feeling confident in their post-visit care?
Hello, good afternoon. Yes, well, the communication that we try to always have with the patient is first is listening to the needs of the patient. When they walk in, how can we help them? So always listen to them first. An example in this case with the patient is he came very frustrated because he came with a bunch of orders, didn't know what is what, where to go. So what we did is we went over each order, explained some was for specialists and some was for our department. I prepare him for each test, how long it takes, how to prepare, and what to expect. So that helped him to have a better vision to organize his day and his schedule. That like calmed him and make them more secure. And the day when he came, after he does his test, we just don't say like, oh, bye, have a nice day. You know, I try to always approach him one more time and say, how did the test go? How did it go? You know, I learned a little bit more if he feel with our service. So we also, a little thing that I always like to do with the patients is like, hey, please don't forget to follow up with your primary or your referring provider so you can discuss your results, something very important. So, you know, with that, when I go beyond and explain all these little details, but very important, I see that the patient goes or leaves our department feeling confident and make them happy. And let's say the goal of my day is when I see a patient with a smile and says, thank you very much for your help. So that makes my day.
Yeah. Wonderful, Helen. I saw Zach applauding for you as you're speaking, a wonderful message. And you know, not only is that communication such a great talent and skill that makes a difference, it improves health outcomes for our patients when they really understand their post-care instructions. It's so important. And I'm so glad we could highlight that for our audience and inspire other employees around the health system through your story on the importance of that and how to do it really well. So thank you so much, Helen. Okay, congrats. And I'm going to go next. We have Dr. Lisa Dabney standing by. She's ready to be honored from Mount Sinai West. Leaders at Mount Sinai West shared a patient letter highlighting Dr. Lisa Dabney. And I'm going to turn it to Andres Moreira to share this story representing Mount Sinai West. Hey, Andres.
Hello, Stephen. Good afternoon, everyone. So really excited to share this beautiful patient letter that we received about Dr. Dabney. So a patient writes, quote, I would like to compliment my surgeon, Dr. Lisa Dabney from Mount Sinai West. I saw Dr. Dabney for a problem with a prolapsed uterus. I had seen numerous doctors over the years and dealt with this rather than have the surgery. Dr. Dabney never pushed me to have surgery, but the fact that she spent several visits going over what the procedure entailed and how I would be recuperating enabled me to make the decision to have the surgery that I put off for too many years. I will always remember that Dr. Dabney said that after the hysterectomy, the feeling among patients was that they wished they did it years ago. I agree, but it took a special doctor like Dr. Dabney to gently give me the support and confidence that I needed to go ahead with this procedure. Dr. Dabney goes above and beyond in terms of her kindness to her patients, and she's truly one of a kind. Thank you and Mount Sinai for such a positive surgical experience. Congratulations, Dr. Dabney.
Yeah, thanks, Andres. And this is a wonderful patient letter. And then your leadership also shared about how residents and fellows are often seeking you out for your ability to provide excellent clinical training. And Dr. Dabney, I'd love to hear you describe that role model clinician you strive to be, that others are drawn to, and how we see that through the eyes of this patient.
Well, thank you everyone for honoring me. And I think that, you know, certainly patient letters like this, which other providers have talked about, is kind of the reason why we do what we do. I mean, it's very, very rewarding to get thanks from patients, and that's probably more important than anything else. I mean, I'm a urogynecologist, so I have the luxury of really not having to operate on anybody for the most part. I mean, I have a few emergencies, but they're rare. And so I feel like it's very, very important never to push patients into surgery and kind of let them wait to come to that decision themselves, because if patients feel very strongly that they are making the decision to have surgery, their recovery, their pain levels, everything is so much better. I mean, some cancer surgeons don't have that luxury. I'm very lucky that I kind of do, but I also teach my residents, like, you know, urogynecology in the OB-GYN world is like one of the few specialties where like you can really take your time. I mean, you can't stop pregnancy, you can't stop cancer, but you know, prolapse and incontinence can always wait. So I spend a lot of time with my patients, and I have many patients that come back for 5, 6, 7 visits before they finally make the decision. And I always tell them, I'm like, you can cancel your surgery 5 times. Like, I don't want you having surgery until you feel like you're ready. I think it's really important.
Yeah. Well, and now we see why these residents and fellows are seeking you out. That is such a great insight, and just how do we help our patients without pushing them? And that's what this letter described. I never felt pushed, but I was informed and allowed to make that decision with space, and that led to the outcome that you were all hoping for, which is this patient feeling great now that she's had the surgery. So thank you so much. A wonderful insight, and we're glad you're able to share it with our audience today.
Thank you.
Okay, thank you, Dr. Dabney. Andres, we'll be back to you soon for another story from Mount Sinai West. You know, one more who just today couldn't make it, so this story isn't in your program, but Javier Lozano of Union Square, Mount Sinai downtown, isn't able to make it, but he was praised by a patient for his kindness and for making them feel welcome when they come in for their infusions in oncology at Union Square. And we just wanted to highlight Javier Lozano from Union Square, who couldn't make it here today last second. So thank you, Javier. We're going to go into our Stories of Excellence section next, and we've got our pair of pharmacists. Mount Sinai Health System pharmacy leadership recognized 2 pharmacists from Mount Sinai Hospital. So we'll have God's Favor Guillet come up and represent MSH, and that is Paulina Lerner and Melissa Brega. Welcome to this team and God's Favor. Let's hear this story.
Congratulations. Here's the star. Clinical Pharmacy Manager Paulina Lerner and Assistant Director of Pharmacy Melissa Brega of Mount Sinai Hospital went out of their way to go to the Madison Avenue Pharmacy to purchase Eucerin for a pseudo-severe compound for a patient with a physical case of monkeypox. This allowed therapy to begin immediately as opposed to delaying until Monday. This patient had been on systemic therapy for a few weeks with incomplete resolution. Rapid initiation of the topical treatment was deemed important for patient comfort and care. The Eucerin was necessary as this was the only non-ointment base used in any of the recipes they could find, and it is not something we routinely carry. So they went out of their way to a local pharmacy to find and purchase it. A great job by both pharmacists to make sure the patient was treated.
Yeah, thank you. So this is a role model of our We Find a Way promise for sure. And, you know, we shared the story of the process for how you reach this positive outcome. But could you tell us about the commitment you make in the pharmacy to all of your patients that drives this kind of effort, this above and beyond approach to caring for them?
Sure. So good afternoon, everyone. Paulina and I are so appreciative of this recognition. But we don't start our day thinking about how to go above and beyond. So patient care is our top priority each and every day. And we do what we need to get the patients, our patients, the medications that they need in the most efficient way. And in this particular case, it was a Friday afternoon. It just made more sense to go out and purchase it ourselves than to follow the formal order and delivery process.
Yeah, I agree. And you have a patient in discomfort, and that is something very upsetting. We would not have felt comfortable waiting throughout the weekend. I think it's definitely a priority to be able to procure medications and explore all avenues that we need to, if we're able to get it to them and make them more comfortable.
Yeah, and that's a commitment that is a role model commitment to saying, look, I know what's going to happen. I know what they're going to experience. I won't stand for it. I'm going to be agile, creativity, putting our values all in there, right? And making sure you did what was best for them. And that kind of commitment is just a role model example of what we hope everyone here at Mount Sinai commits to. So thank you so much. Wonderful story. Thank you for what you do for our patients. Congrats.
Thank you.
Team. All right, God's favor, we're going to stick with you. Our next one in our Stories of Excellence section, which again, these are these one-time events that we're highlighting, although they're usually indicative of employees who go above and beyond all the time. This next one is for Mount Sinai Hospital for Aura Weltman, and I'll leave it to you for this remarkable story.
Excellent. It is truly remarkable. Advanced clinical specialist Aura Weltman was on her way to work one morning and called a colleague to say she would be 30 minutes late due to an emergency. This emergency was delivering a baby outside the hospital on Fifth Avenue as a woman on her way into labor on the sidewalk. Aura demonstrated extraordinary dedication and expertise, drawing upon her past experience as an EMT. As she sprang into action, swiftly applying her knowledge to ensure a safe delivery. Her agility and excellence showed through as she calmly and competently brought the baby into the world, all the while maintaining a compassionate and comforting demeanor toward the overwhelmed mother. Aura's concern for patient safety was evident as she promptly sought additional help to transport the mother and newborn safely into the hospital. In this remarkable instance, Aura exemplified agility, excellence, compassion, and an unwavering commitment to ensuring the well-being of those under her care.
Yeah, thank you, Aura. Just wow. I mean, normally most of us coming in on our way into work, I'm trying to get my ID badge out with a cup of coffee, and you're delivering babies on Fifth Avenue. So from your experience, what did you feel in this unforgettable moment? What mindset guided you through this emergency event?
Hi, thanks so much for having me and for the chance to speak. I think that really there wasn't too much running through my mind other than keeping the mom and the baby safe. And it was really all this training had flooded right back to me at that moment. And I really felt, I was telling Kathy, like I was guided from above at that moment. And I think it was actually just pretty funny when it was actually happening. At a certain point, the baby was in my arms. We were kind of waiting for a team to come, and I called for a team to come. And the mom said to me, where is everyone? And I said, they're on their way. There's going to be a team here. They're going to be, available in just a moment. They're on their way. And then I was thinking in my mind, like, oh my gosh, where is everyone? I hope they get here quickly just to help her. But thankfully everything went really, really smoothly. And when I got upstairs, I'm an occupational therapist. So I got upstairs and told the whole team kind of the story and explained why I was late. And one of the physical therapists here said to me, did you tell them that you're an OT and not an OB? So we all got, but I just feel really lucky to have been part of that miracle. And I'm happy to have been able to, to help.
Yeah, well, how amazing that you'll forever be a part of their story. I'm sure there wasn't time for selfies in the moment that the mother could have gotten with you, but I hope you were able to connect afterwards, and you'll never be forgotten in their family story. What an amazing and incredible story, and just how you locked into the moment and did what you need to do is inspiring.
Thank you.
Truly incredible. Thank you, Aura. And thank you, God Saver. We'll be back from Mount Sinai Hospital a little later on. For now, we're going to go to Mount Sinai West for another story of excellence, our last in this category. And it is for Latoya. Yeah, let's bring Latoya up and share this story from Mount Sinai West Ambulatory Leadership. Hey, Latoya.
Hey, how you guys doing?
Hi, good. All right, Andre, take it away.
Absolutely. Good afternoon, Latoya. So really excited to recognize you. So Latoya, who just last month was promoted to supervisor in the Division of Rheumatology, naturally makes everyone feel comfortable, which allows people to open up to her in special ways. One particular patient had severe reactive arthritis requiring aggressive immunomodulation. After his appointment with the provider, Latoya went in for the blood test and spent an unusual amount of time with the patient. When she came out, she informed the provider that the patient was in the midst of a crisis, struggling with polysubstance abuse because of the psychological toll of his new diagnosis. The patient confided this in Latoya because she made him feel secure. The patient ended up going from our office to a rehab program. While the provider was laser focused on his inflammatory disease, it was Latoya who brought out real healing and quite literally saved the patient's life. Latoya truly embodies Mount Sinai's core values, and we are so excited to see what she will accomplish in her new role as supervisor here at Mount Sinai West. Congratulations, Latoya.
Yes, thank you so much. I really appreciate it.
Thank you. Yeah, Latoya, congrats on the recent promotion and well deserved.
you.
And I'd just love to hear you share a bit about your approach that you feel helps patients feel comfortable and safe opening up to you that made the difference in this experience.
Yeah, definitely. So first and foremost, with me, when it comes, I love what I do. And every patient that walks through the door, I treat them all as family. You know, so we have a lot of patients come in, they have a lot of issues going on, and they're really nervous, and they just like confused on what they're gonna do. I just want to reassure them that we are in this together. We are a team, and they are my main priority. So I kind of like smooth things out for them, you know, so we have a good connection at all visits. And it's an amazing outcome. You know, the patients come in every day for follow-ups, and they just greet me at first name basis. When I'm not here, they look for me. And it's really important for me to make sure that they're comfortable and they know that we're here together.
But building that trust made a difference. It literally could save this person's life.
And having a level of emotional intelligence as well too is a must. You know, this world needs a little bit more of care and love. And that's what I'm trying to give here to everyone.
Absolutely. And I'm so glad to hear that you're now in the supervisor role. They're
Thank you.
leading with that mindset
Yes.
for those who
Yeah.
report up to you now. And if you can bring that to your whole team, what an exceptional difference you'll all make in your work with patients. Thank you.
Thank you.
All right. And thank you, Andres. You know, at this point, I want to take a quick pause after Latoya. Latoya, what you didn't know is you are actually a milestone member of our history of Beyond the Badge. I'm going to switch things up to share with everyone. That was our 500th story. Our 500th Beyond the Badge story of excellence. So I want to pause for a moment in our 25th episode here. We have about 20 per episode, and that math gets Latoya in our history books as the 500th story we've shared.
Thank
you.
you.
The badge, always a part of our story. And it's such a great one to end on, Latoya. And I just want to take this moment to thank everyone who's involved in this program. It is a collaborative effort. Thank you to Joseph Mary, to Swati Garg, to Hillary Polly, who run those huddles, those system daily huddles, and lead them and have embedded this moment into the culture of those huddles. They collect the stories and they send them to our team. I want to thank backstage Michael Joseph, Jessica Rubin, and Khadija Mohammed, who is part of our team, as well as Elisa G. and Andrea, who's our normal program manager for this, but she's out on her maternity leave. So we wish Alyssa well, but is a part of our program here. And to all of you who keep coming back, to all of our Spotlight Committee members who read our stories every month, and to, of course, to all of our honorees for being role models whose stories are captured and are inspiring our senior leaders to say, I've got to share this story. I've got to recognize this person. I've got to talk about what they did. I'm so proud of them. That's the people we're celebrating here 500 times and counting. So a little moment there. I'm going to stop my background here in a moment and move on to our next section, which is our commitment to caring, or our stories of excellence that are provided by colleagues. So a lot of them come from our star recognition when peers recognize each other. And I'm going to go first to Mount Sinai Morningside Ambulatory Leadership, who recognize Jocelyn Carrasco Alviar. I'll have Tyler come back up to represent Morningside. And Jocelyn is actually not only our 501st story, but probably our 390 something story. She was part of a 3-person team back in August of last year. Welcome, Jocelyn. Tyler, I'll turn it to you.
Awesome. Thanks, Steve. Yes. So we received a letter from our cardiology nursing team sharing how Jocelyn went above and beyond when they went to the outpatient clinics to ask for assistance in ordering flu vaccines. Despite Jocelyn being very busy seeing patients, she took the time to explain the whole ordering process. She patiently answered all of their questions and provided them with with valuable advice, best practices, and even showed them how to print the patient education forms. But Jocelyn didn't stop there. She walked the nurses over to her medication room to show them where and how she stores her vaccines, emphasizing the different doses. Jocelyn educated the staff on how to safely separate the vaccines and doses in the medication fridge to avoid vaccine administration errors, and she's a tremendous addition to the Mount Sinai Morningside ambulatory team, always exhibiting kindness and a genuine interest in helping others. We're so fortunate to have her as part of our team, and congratulations, Jocelyn.
Yeah, thank you, Tyler. Such an excellent example of great collaboration and great teamwork when you're assisting another team in the best interest of our patients. And Jocelyn, I'd just love for you to share your personal thoughts on the colleague and the team member you strive to be here every day at Mount Sinai that inspired you to help so much.
Oh, thank you, Steve, and thank you, everyone. Good afternoon. First and foremost, this is for Joanna Agudelo Pamplona and Tia Coleman from CVI. In behalf of our OPD team, I want to say thank you for this honor. Most of the experience that I've had in ambulatory, I want to thank my IAM family, especially Juderica Goris, Judy, as everybody knows her. She has mentored me a lot with all of this things in ambulatory. I was never an ambulatory nurse. I was an inpatient at Mount Sinai Hospital. So 8 years ago, I started with them, and I am very grateful for the experience that I've had with them. And I also want to thank Christine Citadino, our Senior Director for Ambulatory Services. You have introduced Mount Sinai community to our amazing OPD team. And as their RN, I am very proud to represent the OPD department. For 34 years as an RN with Mount Sinai Health Systems, I have always been ingrained with the fundamentals of helping and collaborating with other teams to create better outcomes. We are also indeed better together. Hence, when Joanna and Tia came for help, there was no reason not to help out. It's always, for our future nurses, it's always a good thing. Like, there's never a reason to be kind. There's no need or a reason to be grateful and to be empathetic with others. So I'm also very blessed that with mentors that have come through my experience, they unselfishly share their knowledge and their expertise in their practice, in their fields of practice. So every day, I aim to honor them by paying it forward. And it is in doing so that we will pass on the legacy that is Mount Sinai. I thank you all.
What a beautiful statement, Jocelyn. Thank you so much. And I agree, you never need a reason to be kind. And that obviously is inspiring you every day. A wonderful message. And then thank you so much for being such a wonderful colleague and team member at Mount Sinai Morningside for 30 plus years and counting.
Yes, and counting.
And counting, that's right. Excellent. Well, thank you. I'm going to go back to Mount Sinai Hospital. Ambulatory leadership there recognize Joseph Long. So we'll bring Joseph up and have God's favor come back up for this next story.
Wonderful. Congratulations, and I will read the star. So Joseph Long, an LPN in the internal medicine practice, is a dedicated and compassionate team member, as evidenced by Dr. Town in the following message. A few weeks ago, Joseph, my resident, and I were the last people in the evening session, and we had a patient who was determined to go home despite having an unsteady gait. He didn't have a rolling walker or any assistive device. Joseph walked the patient out of the practice and to the bus stop on Madison Avenue before going home, and this was almost 9 p.m. We thank Joseph for going above and beyond in the care of this patient as he embodies the mission, vision, and values of Mount Sinai.
Yeah, absolutely. Thank you, God's favor. And we're not seeing Joseph because I know he's on phone alone. So I see you came off mute, Joseph. Hopefully you can hear us well. This is another example of a single powerful moment that's an insight to us in the compassion and kindness you surely show to every patient. And I'm wondering if you can describe what's at the heart of the clinician you strive to be every day for the patients you care for.
Yeah, thank you. Sorry, I'm a little computer illiterate, so I couldn't get my USB camera to work. Yeah, I mean, I think it's funny to be recognized for walking somebody down to the bus. I was leaving anyway. But I would like to take this moment to kind of recognize the team that I work with and everybody that I work with, because this was just a small little gesture. And like, I've seen everyone that I work with go, like, step outside the role of a nurse or a doctor and just like meet somebody as a human and just kind of, you know, treat them with respect and courtesy. And like, You need somebody to walk them out, so you walk them out. Or they need somebody to comfort them, so you comfort them. It's not part of the job description, it's just what you do.
Right. Thank you, Joseph. Well, you shared how you see everyone else doing that, and maybe perhaps that's inspired you, and you're doing that role model for others now. It was seen by a colleague who was inspired just to see these little moments of being human and taking that extra step because you care. And this person shared what it meant to them as an example of why they're proud to be a part of that team. So thank you so much.
Yeah, thank you.
These small moments are what make the difference for sure. I'm going to go on to our next story, Godsaver. We're going to stick with you and bring up Joshua Rochard for our final story in this section of appreciation by colleagues. So let's turn it to you.
Congratulations, Joshua. Senior Supervisor Joshua Rochard consistently demonstrates commitment to his work ethic or a cause. He's always willing to go above and beyond for our patients, visitors, and staff. His commitment inspires others and creates a positive work environment. Joshua is an effective team player. He contributes to the team's goals, communicates effectively, and collaborates with others. Joshua displays strong leadership qualities, such as the ability to motivate and inspire others, make tough decisions, and take responsibility. He brings positivity to work every single day and is a valuable asset to the Mount Sinai Security Department.
Absolutely. And I happen to know, I got to give a shout out. I was talking to Joshua beforehand. He was just hit our 20th anniversary last year. It was the last time I got to see him and celebrate him as he hit 20 years. And, throughout your career, I've been hearing the themes in this story about your positive self and the positive communication throughout this message. Can you talk about your leadership style and how you care for and inspire your exceptional team of officers?
Sure, Steve. First and foremost, congratulations to all honorees, and thank you for honoring me as well. I appreciate it a lot. If I have to define my leadership style in with one word, I would say it's an inspirational approach. With the security team that we have, actually believe that they are actually prescribed medication to patients when they come into any one of our lobbies. Most of them put on their jobs as well that they want to put a smile on the patient's face going in. They want to reassure them that they're in a good place. Everyone around them is a caretaker. So in addition to us providing security services, they're also caretakers as well. If I could share a quick story, so I try to instill pride, in each one of the security officers and them that we have. And I see a result when I get a phone call from a patient saying, "Can you meet me in the lobby? Are you the supervisor?" And I say, "Yes." And a patient is there with an envelope loaded with cash. Right? What is this for? And the patient is like, "One of your officers last night put my husband and I in a taxi and sent us to Long Island where we live because we had no cash. And I'm here to return the money. I'm here to return a favor." So with that approach, with my style and everything that I'm trying to instill in them, I see a result.
Wow.
And it's amazing to get feedback like that and to see the results, of my leadership coming working out this way. So, I take pride, in working at Mount Sinai 20 years, 2 decades now. Thank you to the Mount Sinai team, family, community that actually got me to the place where I am today. I appreciate it.
Oh, thank you. So wonderful. What a story, an example. And clearly, like you said, the being inspiring and being proud yourself and being able to instill that pride in the impact your officers make every day is incredible and so important. And we see it. We all see it because we all see your officers at every entrance and we so appreciate them.
Thank you.
All right, thank you. We're going to go into our final section. Hang with us. We got 3 stories to go. We have Maltheo Yusan couldn't attend today, but he was thanked for his contributions in the behavioral health transfer process in support of their go live of that behavioral health center. But we've got 3 more. We're going to go next to Mount Sinai Beth Israel, where social worker Wendy Egan is being honored, and we'll have Christine Pescator read this story.
Hi, thank you, Stephen. Social worker Wendy Egan has been tirelessly serving our patients and families at Mount Sinai Beth Israel for 33 years. She provides care, education, and guidance to patients with complex medical as well as social issues, and is an absolute expert in palliative and end-of-life care. Wendy facilitates family meetings and goals of care collaborations where she leads with sensitivity, knowledge, and respect for patients' wishes. In addition to being a dedicated social worker, Wendy has trained countless social workers and social work interns. With passion and enjoyment, Wendy has been sharing her competence with the future generation of healthcare professionals to ensure the best possible patient care.
Yeah, thank you, Christine. And, in the spotlight section is often when a leader says, the whole body of work, someone's incredible career here at Mount Sinai, I've got to share it and spotlight this person. So Wendy, throughout your impressive career, can you talk about what's always been at the heart of your work with patients and families?
Sure. And thank you, Christine. I think the heart really, if I think about my 30 plus years of being here and working with patients, is really bringing my patient's voice to the table. And I've worked with step-down vent patients, ICU patients for most of these years. And unfortunately, they're unable to bring their voice to the table. So for me, it's really important to ensure that if their wishes are known, fantastic. And if they're not, then I elicit through their families what they would want, and we make sure we honor them. And unfortunately, I've had so many patients that come in that we don't even know their name. So I made a promise to myself that I would do everything possible to identify them. And then my commitment to finding family is because I think there's a common thread that I've heard here about how we treat our patients like family. And if that was my family member lying in that bed, I would want to make sure, regardless of what the outcome is, that there is a family member there that can be their voice and make decisions for them.
Yeah, to be the family member for someone as you find their families and find out what you can do for them. Being that advocate is something I so recognize as being an incredible social worker and a role model social worker and part of our team. Thank you, Wendy. Really beautifully and well said.
Thank you.
Thank you. And thank you, Christine. 2 stories to go. We're going back to South Nassau. Laboratory leadership for the health system recognizes South Nassau laboratory employee Maureen Ecke. And we're going to bring Maureen up. And Rob, you can share this story. Hey, Maureen.
Hi. All right. Hey, Maureen. So Maureen Ecke has performed superbly in her role as the lead histology technologist at Mount Sinai South Nassau for more than 10 years, which includes doing cytoprep, cutting frozen sections, and special immunohistochemical staining. She is an upbeat and positive person and a team player who is always willing to go above and beyond her normal work. As an example, the department was functioning without a histology supervisor during a recent New York State inspection. Maureen stepped up and ran the department, made sure all the department's books and procedures were up to date, and worked closely with Dr. Drexler, who was new to the department, to bring everyone up to speed to make sure the department was running in tip-top shape. Thank you, Maureen, for going above and beyond to help in all aspects of the anatomical pathology lab.
Yeah, thank you. And Rob, sorry to give you some doozies of some words in there, but it shows that, some of these healthcare roles, we can still learn a lot about. So Maureen, can you describe the work that you do in the lab and what brings you pride and how your work makes that meaningful difference in the care of our patients?
First of all, I just want to thank God for getting me to this point in my career. And I want to thank my husband, my kids, and my medical director, Dr. Stephen Drexler, for maintaining the high standard in the anatomic and pathology department. Going beyond the badge means to me having deep compassion for your patients. I mean, we've heard this among most of the celebrants. You treat people the way you want your family to be treated. Because these patients come in hopeless and down, and it's our point to make them feel better. Little things that you say, your face, your gesture could make people feel much better. So that's the approach I try to take when it comes to my patients. No matter how your day is going, you just have to remember that's, it could be you, it could be your mom, it could be your brother, it could be your sister. So to me, that's always been my approach in the departments as a whole. And I also just want to thank everybody for even honoring me, because we get caught up in our little world And sometimes it takes someone else to like stop you and just commend you for things that you do. So I just want to thank everybody for your time, for your patience, and putting this program together. Because sometimes all you need is a pat in the back just to make you know that you're doing the right thing. So thank everyone.
Thank you, Maureen, and congratulations. And we're happy to help you have that pat on the back. And you're hitting that same thing we've been hearing throughout the day, which is those little things. Those little things can make such a difference. And committing to providing those little things and adding those little things is what makes a difference in our patients' lives. So thank you so much.
Thank you.
And I got Seema Setia standing by to share our final story. Hang with us for a little overtime. Digital and technology partners recognize Jessica Spector, our big finale of season 3, episode 1. Let's bring Jessica up and turn it over to Seema to share this story.
Thanks, Steve. Congratulations, everyone. As someone who has had the opportunity to work on a project with Jessica Spector, I am thrilled to share the following message. Jessica Spector has consistently demonstrated a high level of professionalism, strategic thinking, and effective communication skills. Her ability to understand and align business objectives with digital and technology partners initiatives has played a crucial role in the success of numerous projects. Jessica's approach to identifying opportunities for collaboration and addressing challenges has significantly enhanced the overall effectiveness of our business relationships. Her dedication and commitment to fostering strong and productive relationships with our key stakeholders has not gone unnoticed. Jessica has done an amazing job, and we celebrate her. Thanks, Jessica, for all that you do. Your hard work and dedication are truly appreciated.
Thank you, Seema. And Jessica, your leadership notes your dedication and commitment to fostering strong and productive relationships. Can you share insights into how you do that? How do you form such strong relationships with the various teams and the stakeholders you collaborate with?
Hi, thanks, Steve. I know we're over. I'll be as short as I can.
Oh, go for it. We got time.
I just want to thank Ed Robbins for nominating me and also for mentoring me. He's really guided me and allowed me to grow into this role, and to the South Nassau leadership for partnering with me and really allowing the relationship to grow. I think that there are 3 main principles for building relationships. It's trust, transparency, and communication. Trust and transparency go hand in hand as they create a culture of collaboration and mutual respect. I provide timely and accurate information that includes both the successes and the challenges. By sharing the challenges, the team can create the solution together. As Seema, we did. Good communication encompasses both my communication to the site and the site's communication back to me, which is probably more important. By listening to the stakeholders, you're really able to understand their priorities and their needs. That, along with regular meetings, allowed me to build the relationship I have today with Mount Sinai South Nassau. Thank you.
Oh, really wonderful. Thank you. It's a training right in itself. You give us a little micro training on great communication, that trust, transparency, and communication, all integral parts to be an excellent collaborator. Well said, Jessica. Thank you for the great work you do in digital and technology partners and across that work across the health system. Thank you, Jessica. Thank you, Seema. And with that, everyone, thanks for hanging in there. We are wrapping up our first episode of season 3. We are going to keep coming back to you every single month. If this is your first time coming, join us again. 4 weeks from today, we will have the celebrants from February huddles in 2024. One was mentioned today. Someone was honored on the huddle this morning. We're going to have that story and the others from February to bring to you on March 28th. We're going to pop up that date, but I'm going to say goodbye. Thank you for being here for our debut of season 3. We'll see you next time.